Anxiety, anxiety attacks and anxiety disorder, how to management anxiety attacks and disorders. Welcome to Self-Development, Anxiety and Stress Management channel. This video describes anxiety, anxiety attacks and anxiety disorder. It also explains different forms of anxiety attacks and disorders, and how to treat anxiety attacks and disorders. Let me start with these quotations. Worrying is carrying tomorrow's load with today's strength, carrying 2 days at once. It is moving into tomorrow ahead of time. Worrying doesn't empty tomorrow of its sorrow, it empties today of its strength. Corrie ten Boom. Our anxiety does not empty tomorrow of its sorrows, but only empties today of its strengths. C. H. Spurgeon. Smile, you are stronger than you could ever know. Laugh, it is good for your heart and soul. Believe, because miracles happen every single day. Charlene E. Jackson. If you want to conquer the anxiety of life, live in the moment, live in the breath. Amit Ray. Anxiety is a mental disorder in which a person fears just about anything and they think every outcome will turn out for the worst. This fear is frightening because it is so intense and they always fear that someone is after them. If a person has any type of disorder that is associated with anxiety, her mind will always be focused on being scared for no reason. That person will always feel that there is no solution to the unfounded fear and there is no way out. The person would think he or she is on the verge of a heart attack. He would think something is really wrong with you. However, he is far from dying. Such a person might feel paralyzed as though he or she can't do anything. The person will be frozen with fear and this disorder can attack at any time. Anxiety disorder is more than just one action. Anxiety disorder has different sub-disorders that can fit under this. For instance, there are panic attacks, obsessive-compulsive disorder and others that are related to the anxiety disorder family. There are many people all over that suffer from anxiety attacks. If you are not afflicted with them, you may know someone who is. If it is you, you need to know how to help yourself. If it's someone else, you need to know how to help them. You should be considerate and help them to get the treatment and support they need to combat this condition. Causes of anxiety. There are several causes of anxiety disorder. You may think that there are certain things that trigger it. Well, there could be, and then again, it may be something that just happens. It all depends on how it is perceived. Those that the anxiety attacks or related disorders may have one attack. Then they may go back to the scene where the initial one took place and have another one. They are reminded of what happened before. They will feel bad and end up having another one without thinking about it. It seems like a constant cycle of intense fear. Then they feel that they will have more attacks. Believe it or not, it's all in the mind. If you constantly fear and expect to have an anxiety attack or something related to it, then it will happen. The thing about this is people that experience these attacks resent having to hear that it's all in the mind. They feel that people are brushing this off as something that you can get over. The feeling of anxiety comes from your brain. Studies on anxiety disorder revealed that there are at least 2 areas of the human brain that help to trigger the sense of fear and anxiety in your mind. It causes your brain to have a defense mechanism and then you react. There may, however, be situations that you may think cause anxiety and related attacks. Some people have so much stress nowadays. It can come from office politics, overwhelming debt, family issues and other events that can bring this on. There are also some drugs that can trigger an anxiety attack from side effects or withdrawals. This would include alcohol, caffeine, cold medicine, decongestants, nicotine, diet pills and numerous other medications that people take for various ailments and illnesses. Not eating right can also be a contributor to anxiety. There are some situations where you may have to take a test or face a lot of people. If you're not ready, you can get nervous or jittery. WHO suffers from anxiety. There is no certain group on this earth that is a target for anxiety and related attacks or disorders. Who do you think suffers from this? Well, it could be anyone. It could be in your family, your friends, co-workers or anyone that you may know. A lot of times, it could be those that you know and you would have never thought in a million years that they would suffer from something like this. Unfortunately, these attacks are usually kept secret and not disclosed. This is one of those sweeps under the rug embarrassment moments. This is not something that is talked about out in the open. Some people will acknowledge dealing with this when they are caught in the act and can't fake it. Believe it or not, there are people such as politicians and even celebrities who are suffering from anxiety attacks and related conditions. They, however, pay their publicists and others to keep it out of the public eye. They don't want to be in the spotlight because they have to work on keeping up their image. What they may not realize is that someone may be able to benefit from their disclosure. Unfortunately, for people that have to deal with this, anxiety attacks affect and tend to interfere with those who are trying to live a normal life. If you have excessive anxiety attacks, it can be related to a psychiatric condition. When these attacks become serious and they last a long time, they are considered to be out of the norm. Forms of anxiety attacks. There are several forms of anxiety attacks and disorders including 1. Generalized anxiety disorder, GAD, 2. Social anxiety disorder, 3. Obsessive compulsive disorder, OCD, and 4. Post-traumatic stress disorder, PTSD. We now proceed to discuss these anxiety attacks one after the other. 1. Generalized anxiety disorder, GAD. Generalized anxiety disorder, GAD, is associated with people who are constant worriers and are always tense. Frankly speaking, there isn't really a cause for this, nor is anyone nor anything at fault to provoke it. They look for the worst and are always extremely worried about work, family health and money. They even feel anxiety in the course of their normal day. If this pattern is consistent for at least 6 months, a person can be considered as suffering from GAD. They feel that they cannot stop worrying even though the concern is not as great as they make it out to be. It's difficult for them to relax. They are easily startled by people or noises and they have a hard time focusing. Sometimes they cannot sleep at night or wake up in the morning on their own. Here are some other symptoms that contribute to generalized anxiety disorder: feeling tired, aching muscles, irritable, nauseated, sweaty, lightheaded, shortness of breath, frequent trips to the bathroom, shaking or trembling, and hot flashes. If they don't have a high anxiety level and still suffer from a generalized anxiety disorder, they can still be employed and be able to interact socially with others. If they, however, have GAD on a higher scale, they might have trouble doing and completing simple tasks that others would take for granted. Many adults, men and women, suffer from generalized anxiety disorders. Even with that, the risk reaches its peaks starting at childhood and going through the middle-age years. Studies have shown that there are some genes that contribute to people getting GAD. There are other anxiety disorders that happen in conjunction with GAD, such as substance abuse and depression. If treated properly, the person affected can overcome their worries with whatever problems they are dealing with. 2. Social anxiety disorder. Social anxiety disorder, also known as social phobia, happens when a person is extremely self-conscious and anxious. It happens every day in different social situations. They are extremely fearful of being watched. They are also fearful of being judged by others. They try to be extremely careful and go out of their way to not do things that could cause them embarrassment. For a while, they are extremely fearful prior to a situation that they feel can become a disaster. It can become so bad that they lose focus and can't think straight. With a social anxiety disorder, they can allow this fear to cause them to lose focus. It doesn't matter whether it happens at school, work or at home. Having a social anxiety disorder can make it difficult for the person affected to cultivate relationships with others. With a social anxiety disorder, it may be somewhat difficult for people to get over their excessive fears and concerns. This is true even if they know that what they feel is not realistic. Some will try to make amends. Even then there is a feeling of anxiety and they don't feel comfortable when they are around other people. Then they are overly concerned with how others thought of them after the encounter. Some people may be in a social setting, for example, at dinner with someone or more than one person, and still experienced anxiety because they are fearful. They will sweat a lot, blush, shake, or find it difficult to hold a conversation with other people at the table. They always seem to feel that other people are watching them. For instance, there are over 15 million adults in the United States alone that suffer from a social anxiety disorder or social phobia. For the most part, this condition begins as a child and can continue through adolescence. Genetics also play an important role in this regard. This condition is often coupled with depression or other anxiety disorders or attacks. It is not a good idea for those affected to treat themselves with medication. It could make the situation worse. This is better treated with professionals that are experienced in this field. 3. Obsessive-compulsive disorder. People that deal with obsessive-compulsive disorder, OCD, constantly have thoughts that can make them upset. In order to get their anxiety under control, they use compulsions, rituals. However, the tables end up turning on them because the rituals take control over their mind. For instance, there are some people that are obsessed with being clean. They are known as clean freaks. It's a good practice to ensure that everything is clean and tidy, but they can get to the point of being overly controlling about germs or dirty surfaces. They have a compulsion to wash their hands continuously. They don't want any germs or dirt to touch their hands. When they go to the bathroom, they will take a paper towel to open and close the door, just to keep from getting germs on their hands. If people that have OCD don't feel like they look their best, they will look in the mirror several times until they feel they are presentable. They don't want to feel as though they look out of place among others. These actions provide them with a temporary release of the anxiety that they have been feeling. People with this disorder are always compelled to check things repeatedly or make sure that things are in the same place frequently. Sometimes, they are obsessed with ideas of violence or harm to others. They also have thoughts of crazy things that people would not normally think about. There are times when they feel they have to hoard and keep things that they don't need. There are some that have rituals in their home. One of the more common ones is checking the stove several times before they leave to make sure it is off. Having obsessive-compulsive disorder can turn into havoc and an unwelcome interruption when it happens on a daily basis. When a person is ingrained with obsessive-compulsive disorder, they know what they are doing doesn't make much sense, but they don't look at their behavior as something that is abnormal. There are many adults that have obsessive-compulsive disorder. This condition does not stand out on its own. It can be combined with things such as anxiety disorders or attacks, depression or eating disorders. This disorder affects women and men almost equally. It usually starts as a child, or it can start in the teen years or even as an adult. Research has shown that there is an indication that OCD can happen through genetics. To buttress this, many adults start out with OCD as a child. The symptoms of obsessive-compulsive disorder can come and go at any time. If it really gets bad, it can severely affect a person from acting in a normal capacity and doing specific tasks. It's a good idea for those that are dealing with this not to use alcohol or drugs to calm them down. It just makes the situation worse for them. There are certain treatments and medications that can be used to ward off the obsessive-compulsive disorder. They can help people that are in fear or anxiety to be desensitized to what is going on around them. 4. Post-traumatic stress disorder. Post-traumatic stress disorder, PTSD, happens when someone has suffered something that included harm of the body or implied the threat of harm. The person who gets PTSD may have been harmed, or it may have been someone close to them. PTSD is commonly known with veterans who served in a war. However, there are other things, such as rape, kidnapping, abuse, vehicle accidents, plane crashes or natural disasters such as hurricanes or floods. Those who suffer from post-traumatic stress disorder can be easily startled. They also have no feeling for those who they used to have a close relationship with. They start to have less interest in things they used to do. They show less affection, are increasingly aggressive and show more of the irritable side. They try to block out things that remind them of that traumatic event instead of working through it. If the event was something that someone else deliberately acted on against them, then PTSD will greatly affect them. Nightmares can haunt them and they start to see flashbacks such as sounds, feelings and images of what happened. There are sounds that can remind them of that event. For instance, if a door slams, then that could mean that someone has you trapped in a room and ready to pounce on you with their abuse. It could be physical or verbal. Some people don't realize that verbal abuse is just as bad, if not worse than physical abuse. Kindly note that everyone who has been traumatized will not experience PTSD. Some people are able to cope with what happened and move on. There are others that need therapy and medication to deal with their issues. PTSD can start a few months after the event or incident. It could last for a few more months, or continue through the years. In order to be officially classified as PTSD, the symptoms have to continue for at least a month. There are some who end up having PTSD as a chronic condition. Globally, there are several adults who are dealing with post-traumatic stress disorder. It could start from the childhood years and work its way up to adulthood. There are more women who have suffered from this than men. PTSD is also combined with substance abuse, depression or other anxiety disorders or attacks. You can surely overcome anxiety and disorder. With the symptoms of an anxiety attack, the brain relays messages to other parts of a person's body. Certain parts of the body, such as the lungs and heart, work overtime while the anxiety attack is happening. The brain ends up releasing a lot of adrenaline. There are several ways of managing the 4 forms of anxiety attacks and disorders discussed in this video. Be on lookout for our video on how to treat anxiety attacks and disorders. Have you or anyone you know have ever experienced anxiety disorder? Kindly post your view and contributions on anxiety and anxiety disorder in the comment section below. Did you find this video useful? Then give it a thumbs up, and share it with your friends. Also, do not forget to subscribe to our channel Self-Development, Anxiety and Stress Management channel. Thank you for watching.